Hi, I'm producer Laura, and I'm joined here by Dr. Jackie Contreras from DPSS. And Dr. Contreras, I want to know, can you briefly describe what DPSS and the services you offer are?
Absolutely. DPSS is the largest social service agency in the nation. We have a budget of over $5 billion and nearly 15,000 employees. We assist individuals and families throughout LA County with cash assistance, food subsidies, and health insurance. We also administer the IHSS program, which is in-home supportive services, to help people who are blind, aged, and/or disabled to remain safely in their homes. And we do provide some services to immigrants.
Awesome. And how many people do you calculate benefit from your programs?
So we actually serve 4 in 10 LA County residents. So that's
Wow,
4 million people that
that's a
our
lot.
department touches at any given point in time. Our largest program is Medi-Cal, our insurance program, followed by CalFresh, our food
Okay.
subsidies. And then we also administer CalWorks for families and general relief for single adults.
And why do you think having these type of services available are important to our community?
So I believe it's the role of government to provide assistance to people in need. And we saw this very vividly during the COVID pandemic,
Yes,
right? The
for sure.
government had to step up to help people. And there are some individuals whose challenges are more longstanding or more severe who require support on an ongoing basis or to help them through a specific crisis. So I think those are the times when government should compassionately step up to help individuals.
And as somebody, I've been very open, especially on the airwaves, that I have two autistic brothers. So I am actually very, very familiar with IHSS because they're both recipients of it. And having programs like that, because my brother, who's in his 30s, he doesn't act like he's in his 30s. So understanding that he doesn't like being outside of his home and just having someone that can go and help him in home is key. So that's amazing. And I know that we've worked really hard here to raise awareness for CalFresh at our station. And when I started promoting CalFresh, I was overwhelmingly impressed with the responses that I got. I got a lot of responses from listeners who weren't aware of the services, especially men, and I got DMs and private messages from friends who also listened and said, "Hey, I want my mom to apply for this." Or the men were, "I didn't know I could apply for this. I thought I needed to have children, or that it was only for women." So just hearing those types of messages and that type of feedback, how does that make you feel, and what kind of impact do you think that has?
Yeah. So first of all, thank you to you, Laura, and to the entire ESPN family. That outreach we know is really critical. Too
Mhm.
often, people are in need and they don't know where to go, or they
Yeah.
don't feel comfortable asking for support. And so we know that working with people who are connected to the community, people who are trusted by the community, is so critical in order for us to get that word out and to hear that people are coming forward, especially some of the examples you gave that may
Mhm.
not be, the typical people we would expect
Agreed.
to come forward, right? We know that this is making a difference and really appreciate all your efforts.
Thank you. Yeah, for me, probably the biggest one was, and not to single out the men, but it was men because we do predominantly have a male audience, and in our communities, it's hard to ask for help. So seeing that and tangibly seeing that was awesome. And I know you encourage everyone who's eligible for CalFresh to apply, but are there specific individuals that you encourage to take advantage of the resources that you offer?
So I always want to encourage every single person who is in need to seek our help, right? To
Mhm.
to apply. And there are some communities that sometimes it's a little more challenging to connect with, and so we've had some concerted efforts to reach like the LGBTQ plus community,
Okay.
the Asian American Pacific Islander community, and seniors. Surprisingly enough, very often may be in need, but are not, don't know where to go or don't reach out. So we definitely want to do that. I encourage each and every person. So my mother was the eldest of 10 and was a breadwinner for a family for a number of years. And when she was no
Yeah.
longer able to do that, she had to reach out for public assistance. And
Hmm.
I'm so grateful that she did that she had the courage and the wherewithal to do that, because I don't think I would be where I'm at today if that had not happened. So I really want to make sure that we just communicate to people, if you are in need, reach out, we're here to help.
And why do you think people don't reach out? Is it the lack of knowledge or embarrassment, or for seniors, maybe the technology has taken over?
I think it varies. I do think that one key factor is the stigma that people
Yeah,
still hold around public benefits. There are many ways that our government helps people. This is just one of those ways. And yet people will carry that stigma that somehow reaching out for help says something negative about them, and it absolutely does not. And so I think we have to work together to shift that narrative.
agreed. Yeah,
You're sharing your story of your brothers, right?
yeah.
Like, that is so powerful for people to hear that and to know it's okay to reach out.
Yeah, and, with my mom, she came here as an immigrant from Mexico, so she wasn't really aware of a lot of things that the government had to offer and didn't want any help.
Yeah.
And so when she was introduced to IHSS, she didn't want it. She was, "I'm good. I'm gonna
Yeah.
handle it." But there's so many resources that come with it. It's not just the IHS. There's so many additional help. So I'm really glad that she was able to educate herself and just open her mind about accepting that help. And I know we were talking about CalFresh, and I know that it's your fastest growing program. Can you explain a little bit more about it?
So CalFresh provides food benefits
Yeah.
to individuals based on the size of their family, their yearly income, and their expenses. And
Okay.
so it provides dollars for benefits that can be used to purchase fruits, vegetables, other types of healthy foods.
Okay. And you mentioned Medi-Cal is your largest program and is expanded recently to all California, regardless of immigration status. Why do you think that's important?
In this point in time, we are as close as we've ever been to sort of universal healthcare, right? So the
Hmm.
fact that it's expanded to all immigrants, I think, is really, really critical. Healthcare can be one of the most expensive costs, right, that
Yeah.
in any of our lives,
Yeah.
and especially if you experience a health crisis.
Hmm.
And so when people aren't insured, the cost can be significant for the individual and for the system as a whole. So the preventative services are much more inexpensive, and so that's true for anyone, including immigrants, regardless of their status. And so, just generally attending to our health and well-being proactively is important for all of us.
Yeah, and I mean, it definitely, our health plays into all aspects of our life. So I can understand where you're coming from. And where can we go to learn more about DPSS programs and how to apply?
So you can find us online at dpss.lacounty.gov, where you can learn more about our programs and also find out where our local community offices are. You can also apply for assistance online at benefitscal.com. And you can also call our customer service center at 866-613-3777. And to apply for IHSS, you can call 888-944-4477.
And just, I know, like you mentioned, there's a lot of online services for you to apply. In the local offices, would people, like maybe elderly people that are not very familiar with computers, do they get assistance of applying there? Or would all everything's online?
No, no, no. You can absolutely go into any of our offices
Okay,
and you can get assistance for any of our programs. And then you could also, as an alternative, you can use the online services.
perfect. Well, thank you so much, Dr. Contreras, for coming. I really appreciate it. It's honestly, I'm so happy that I've been a part of this. And if anybody needs assistance, just reach out because there's no issue with doing so. So thank you so much.
Thank you.